So, how does this partnership enhance opportunities for Canadian therapists as well as ultimately benefit the US healthcare system as a result?
I know that at least when we graduated, Christina and I, that certain settings were very hard to get your foot in the door unless you had a field work placement already there, and
Right.
that alone was already hard to get for some of the schools. And so it was very tough to get in that setting that you really wanted without any experience at all. And so travel therapy has benefit allowing therapists to gain experience so that they can apply back in Canada if that's something that they end up doing and find that dream job that they want.
Yeah, I'll bounce off that a bit too. A specific example that we've actually been noticing, and I don't know if it has to do with a specific school in Canada or not, but we've noticed a new interest of OTs who want to become certified hand therapist, which is a whole other conversation. I've been told by recruiters, finding one of these is like finding a needle in a haystack. I've heard it, but it's also in demand. And so these Canadian OTs, they're wanting to go to the States to collect their hand therapy hours, which you can get in a hospital, you can get at a skilled nursing facility, depending on the diagnoses. And they're wanting to get those hours to then further their hand therapy career, whether they pursue that in Canada and in the States. And to answer the second part of your question, which how to help US healthcare in general, for the past 10 years, everywhere I go is short staffed. Once you finally get in the door, once you finally see that patient and you can help them, it might be something small like telling them to use a wider utensil. Karen, I know you can relate. Like it might be something so small to us, and you just see the patient's face light up and they're like, oh my gosh, this is so much easier. Like, where were you before this? And it's just, we need more. We need more. We need more OTs everywhere. Sadly we're short staffed. So
We've been seeing it, in almost any clinician specialty, but especially OTs. It's just we need more of them, and the fact that Canadians want to explore the U.S. and explore parts of the U.S. that I'm sure they've never heard of. The fact of the matter is, a lot of facilities that they may be called to are probably places they haven't heard of, towns they haven't heard of. But then, 9 times out of 10, they get there like, this place is amazing. Like, the people are so nice. It's a small town, but like, I feel like I'm part of the community. And that's the other thing is when I talk to travelers, it's amazing when they immerse themselves in the community. And that just pays dividends because now they're so happy that they're there. And now the community like just embraces them and they become part of basically a family. And then it becomes hard to leave, right? And there's just still not enough.
they thought they were going to be there for 3 months and they end up
Yep.
being for a year.
And so extensions happen all the time, and eventually maybe they just go permanent placement there, which is completely okay too. Or they just say like, where else can I go? Where else can I explore? Who else needs my help? And I imagine for a clinician, like that's the highest calling, right? Being able to help others. So just having like the pool of more OTs to come into the stateside and help us out is just nothing better than that.